Hi, my name's Liv. I'm a technician here in the ER. This is Billy. She has a tick on her paw. I need to check the rest of her body to make sure she doesn't have any more, but she does definitely have one on like the top kind of medial aspect of her back left paw. Owner says that she's been not bearing weight or anything. I'm sure she's a little dramatic, but we're gonna go ahead and remove the tick and clean it up and kind of do it so that we can avoid getting any kind of mouthpieces or any of the head left in under the skin. So we're gonna lay her in left lateral for recumbency. Good girl. Good girl.
Doing very good.
You're a good girl. Oh, I know, baby. I know.
There.
All
You
right.
have to go all the way down.
So there's our little friend, uninvited friend.
Good girl, honey. You're doing really good.
Seems like it's causing her a little bit of discomfort. So I'm just going to use some mosquito hemostats to remove the tick. Biggest goal here is going to be to get as close to the base where it is under the skin to remove it, as well as just being careful not to try to like twist or use any jerking movements to remove it, because that's what can potentially cause for some pieces to still remain under the skin. So I'm kind of just going to do one slow motion of pulling it straight out. I'm sorry, baby.
It's okay, Billy. I know. You're doing good. You're a good girl.
I'm gonna go ahead and set it down and put some alcohol in it to kill it. And then I think what I'll do is I'll go ahead and clip some of the fur to make sure I can take a really good look. Make sure there's not anything left in there. I'll go ahead and clean it with some dilute chlorhexidine. So we got the tick off of her. It looks like she has some pretty mild inflammation there, and she was limping. So I cleaned it with chlorhexidine. I'm just going to let the owner know to monitor for any increased inflammation or swelling. You know, put a cone on her if it seems like she's wanting to lick the area while it heals. And he can also use like warm soapy water to clean it if he wants to. You know, signs of infection like additional discharge or anything like that, along with any swelling or increased inflammation, because it should kind of heal on its own. And then, I mean, there's a really, I would say a really small risk of a tick-borne illness. The owner gave flea and tick prevention yesterday, and so I guess there's a small possibility that the tick initially bit her before then. And so there's going to be a small risk in this region. There's really not a ton of tick-borne illnesses to be too concerned about here, but I'll probably just let him know, you know, at the right time if he wants to get tick-borne testing done at his general practice. Then, you know, just to be safe, I think that's perfectly appropriate. But otherwise, you know, we'll send her on her way and she should be okay, and the owner can always bring her back in if there's any concerns or anything.